Lupus, chapter 79, page 617. I covered lupus and gout.
Oh.
And you can take a break and then we'll do our exam.
I'm gonna get something.
2 hours. No lunch, you can power through it. Now you brought it for 1 p.m. Leave home on a full stomach. You ready? Page 617. Okay, systemic lupus erythematosus. So let's read what it is, and then I put up there just very simple what it is. But, lupus erythematosus, or is known as lupus, right, is an autoimmune disorder in which an atypical, meaning a not normal, immune response results in chronic inflammation and destruction of healthy tissue. Other autoimmune disorders include rheumatoid arthritis, vasculitis, multiple sclerosis, scleroderma, and psoriasis. But of course today we're focusing on lupus. In autoimmune disorders, small antigens can bond with healthy tissue. The body then produces antibodies that attack that healthy tissue. It can be triggered by toxins, medications, bacteria, and viruses. Control of the manifestations and a decrease in the number and frequency of exacerbations is the goal of treatment, but there is no cure for autoimmune disorders. Occurrence of autoimmune disorders increases with age. And we'll go back to read about gouty after. So, for lupus, there can be different types, but we look basically and more so overall at systemic lupus erythematosus. Okay? And this one affects the connective tissue, so like basically like certain kind of like types of skin almost that's around, because you have skin around, not like the skin you have outside of your body, but you have skin, you have like layering around your organs as well, and inside your body you have this connective tissue throughout your entire body, not just on your skin. So because it affects that connective tissue, it can affect a wide variety of organs from your skin, and yes, the skin is an organ, right? Liver, kidneys, lungs, intestinal tract, right? It can affect a lot of these. So, I do need you to know the risk factors. And the 2 more common ones are genetics and females aged 20 to 40. Ethnicity, African American, Asian, Hispanic, or indigenous people. Which is everybody except white people. Okay? So, do you guys understand the whole like racist thing, the 5 races? Right? What are they? We pointed this out, right? The Caucasian or white, right? Asian. Hispanic is not a race. Not other. Alright, listen up. So, in some federal ones, what you'll see is that there's 5 usually that are there, right? Alaskan Native, or they'll call them an Eskimo, right? Like it says Eskimo, Alaskan Native, it usually just says Alaskan Native. Or it says Native American or Alaskan Native. So this is like something's written differently, where it says Alaskan Native, or it'll say Native American, right? This one's usually combined. It's like a Native American or Alaskan Native, they'll say. And then you have Caucasian, Asian, Black, and Pacific Islanders. So the idea is, and people have a hard time like deciding, because they're like, well, like for example, in my example, where it's like, well, I'm from El Salvador, right? Or I'm from South America, right? Where you're, Portuguese, Brazil, right? From all these countries, like where do you fall in this? Like you're not Asian, right? So it's not other in the sense that a lot of them get rid of this, or the others kind of like a courtesy, because the idea of this is that all ethnicities, so whatever country you're from, you originate from one of these 5 roots. Does that make sense? So for example, Brazilians would fall technically more than likely under where? Where are they from? They were Native Americans. There were indigenous population there. Now, the reason why you're allowed to choose is, and you'll see this distinction in Mexico. In Mexico, you have 2 different types. Have you seen that some of the population is varied? Right. Because of the European invaders. And then you see that they also have a population that's very varied, and we call it, right, like in Spanish, you see que son bien like, they're like the natives from there, right? Whether they know that they were Mayan or Aztecs or indigenous. We say Indios is the insult, right? Because they were the indigenous people. This one, well, it's not as an insult, but that's when you tell it to people. They're like, "Miras bien Indio," which means you look very indigenous, because to them it's an insult. So, listen up. So the point is even though you're from Mexico, or for example, I've met somebody that was born and raised in Brazil, but he originates, his parents are Japanese. So is he Native American just because he was born in Brazil? What is his race? Where does he probably originate from? He's Asian. Does that make sense? So you originate from one of these. The same distinction can be made that a lot of people think, okay, well, a lot of the black population will come from Africa. So I said, so what about Haitians or Dominican Republicans? South Africans in England. Are they white because they're born in England? Oh, but I mean, there's black people in South Africa and South Africans in England.
Sorry.
I think you're missing the distinction of it. Are black people that are in England white?
No.
Okay. Okay.
Yeah. People like to mix them.
So, you're not, ethnicity is often mixed. Ethnicity is often mixed with race. Race is what is your genetic predisposition. You originate from one of 5 races that you share genetic traits with, and these are usually outwardly expressed. Yes? So we have certain distinctions. Now I say this to break down the barriers. Obviously there are differences amongst us even in this room, whether it's our eye shape, our skin tone, our height, different builds give off these distinctions usually. Now racism or discrimination is when we go ahead and take that trait and we judge you or treat you differently based on it. But noticing or acknowledging that there is a difference, that we originate from difference, is not unusual. Because again, it puts you at a predisposition for certain diseases and or genetic disorders. Make sense? So, it's okay for people to basically, how I say, like, identify or choose where they originate from, but nonetheless, our physical characteristics play a part in our disease development. Does that make sense?
Yeah.
Like people from Africa, they actually have a higher blood pressure than white people.
Yes, and they process salt a lot differently. Hence the whole thing about salt and not eating salt for high blood pressure. But new studies are showing that majority of the population, majority of humans are okay with eating high salt. And it was a thought that occurred to me because here we're taught salt causes high blood pressure. Yes, if you have already developed high blood pressure, it doesn't help. But in more so overall healthy adults, it shouldn't affect. Why?
Because you exercise, stay active.
Because your kidney function's fine, you usually just pee it out. It was a weird thing when I sat here and I remember having that thought, where it was like, why can't we eat a lot of salt? And I was like, why don't I just pee it out? Like your body doesn't just hold on to it, it'll balance you. But since it would potentially for short term raise your blood pressure, people with hypertension already have high blood pressure and it affects them negatively. So for most people it's okay. I'm not saying go eat a bunch of salt, but the whole 2 gram thing is realistically like
It's an
4 to 5
American,
grams.
it's an American thing.
Yeah. Okay? Everybody good? Alright, expected findings. Feel free to look in your books. And I want you to highlight these key ones. Now all are relevant, but there are some that are more so. Okay? 1. The fatigue. Anorexia or weight loss. No, I'm trying to read through. Fever, lymph, adenopathy, so any change with your lymph nodes. You'll notice something called Raynaud's phenomenon. And this, for Raynaud's, you can often see it in their fingers. They respond to the cold and stress differently, and they start changing like a different color from the lack of circulation from the vasospasming. So their fingers or hands can discolor. A big one. The technical name is erythematosus rash, hence the name. But it's more commonly referred to as a butterfly rash because of how it looks on their face. So you'll see that the nose is colored and then they develop this redness here. So hence the cheeks are the wings and the nose is the body of it. It looks like a butterfly on their face. Okay, it's redness. Okay, this butterfly rash is the hallmark sign, like the true tell sign that like that's what they suspect. Yes? Okay, diagnostic and lab testing. So, a skin biopsy can differentiate and help detect not systemic, but discoid lupus. It's another form. And then immunology testing is used for SLE. And you'll pay more attention to ANA, which stands for anti-nuclear antibodies. You will see that up to 95% of people who develop lupus have ANAs. So that's the one that you need to know. Now they do run BUN, liver functions, urinalysis, or checking function of the organ that it's affecting, but that's fine. It's again, is the organ being affected, not so that it's specific to the disease. Yeah, so if it's affecting the kidneys, for example, or it's inflamed, you'll see an elevation in BUN and creatinine, but it's not like, that elevation can point to you towards lupus, it's because it's affecting that organ. Alright, nursing care. Monitor the following: pain, mobility, fatigue, yes, hypertension. More importantly is, provide small, frequent meals. Especially with those that develop anorexia. Encourage the client to limit salt intake for fluid retention, secondary to steroid therapy. So if you go down to medications, you'll see that they take corticosteroids. So because they take corticosteroids, this can involve fluid retention. Now, medications you're gonna give them is NSAIDs. Why? Remember that this is just an inflammatory process, your own immune system. NSAIDs will decrease this inflammation. Corticosteroids suppress your immune system and decrease inflammation as well. So things like prednisone and methylprednisolone. And remember that that is pushing you to become hyper. It can be hyperglycemic, but more so just a hyperadrenalism, right, where you have too much corticosteroid. This promotes aldosterone, which will mean that you'll retain fluid and salt. That's why the instruction is to limit salt, not because of the disease, but because of the meds you take for it. Okay. The other thing that they'll give them is immunosuppressant agents like methotrexate. Now, because this will depress your immune system, you monitor for the toxic effects of it. Bone marrow, and it says there bone marrow suppression. And increased liver enzymes. Because it's toxic to the liver. Now, this is again, and I'll remind you and I'll translate it for you. What does that look like? It won't say bone marrow suppression. What will you see? What are potential actual answers for that? That's the results of it, but how would we see? What labs do we monitor? For which specifics?
Neutrophils.
Yes. So you're naming individual ones. So yes, white blood cells, platelets. Okay. Liver enzymes. What's the true answer for that? It won't say elevated liver enzymes.
ALT, AST.
ALT, AST will be high, which is usually more than 40. It's like 30. It's like 40 and 55% that, but higher than 40 would be concerning. And as a result of the low WBC and platelets,
Risk for infection.
risk for infection, prescribed fever, and platelets, bleeding. Yes? Client education. These instructions, some of these I've seen be directly the answer. Because of the inflammation or attack on certain of the organs and or the medication, You wanna avoid the trigger factors like exposure to light. You avoid UV. Light and sunlight exposure, right? So how do we do this? And I've seen these word by word be the answer.
Avoid the sun.
Wear a wide brimmed hat. I know you wanna wear a cool little cute one, but you're gonna wear a big one. Long sleeve shirt. Pants. Put on sunscreen. Okay, mild shampoo and soap.
Steroid cream for that.
Use a steroid cream for the rash. Avoid crowds and people who are sick because your immune system is down. Put on lotion for the dry skin. Pat skin dry instead of rubbing. It also says report evidence of related infections. So what do we report? Or what should they report?
Fever, sore throat.
Alright. So. When I'm done talking, we will go on break and you'll be back at 10:15. And Carla will proctor your exam or begin proctoring it. Make sure you are in uniform. Not violating anything, as she will let you know. We're starting the exam at 10:20. You'll have a little over just about 2 hours to complete